Welcome to the 1 year update on my vestibular Schwannoma acoustic neuroma surgery. I had my tumor removed at the Mayo Clinic in Scottsdale, Arizona, November 1st of last year. So I'm past a little bit past the 1 year at this stage. And I appreciate everybody that's contacted me after seeing my videos with questions and things about their own situation. I love this interaction. I think this is helpful. I wish I'd actually had a little bit more of this when I was going through mine, because there's so much that we don't really understand or talk about when it comes to brain surgery of any sort. And so I appreciate this dialogue. The update for me is I had to go through vestibular physical therapy for about 6 months or so. And in my case, it did actually start to show results. I never had dizziness post-surgery, but what I did have was what I call soft head, where I just didn't feel like I was particularly sharp. And if I had to drive somewhere, I just had to make sure that I focused. I would never actually get on the road if I felt like there was a chance it was unsafe. It never was that bad. It was more irritating than anything else. And there were one or two moments, and on those cases, it was really just maybe a lack of sleep or something along that line. But I actually got back to work and was working for about 3 months at a contract. And during that time, it actually helped my physical therapy quite a bit, because I would jump on the highway, typical work day, you get up way too early, you hop on the road, you sit in your car for an hour fighting traffic, you work, and you do the same thing coming back. But the benefit for me was that it allowed me to get on the highway and it's just chaos. There's cars everywhere doing everything. And I have to maintain focus. The exact same tool set that I needed to kind of strengthen my focus going through this physical therapy. So it actually helped quite a bit. 3 months of that, and it's barely an issue at this stage. The issue that replaced it, however, was there is a little bit of synkinesis. The muscles basically, the nerves rerouted to the muscles in such a way that they don't control themselves autonomously anymore. These muscles pull on these muscles. And the end result of it is, because they are so interconnected, every time I blink, there is just a little bit of muscular movement in this area. The end of the day, as many tens of thousands of times you blink your eye, that muscle's exhausted. And it gets stiff and it gets swollen in some cases, and it's hard to even talk. You slur your words just a little bit. And so the physical therapy I'm going through now, which has already shown some signs of improvement, and there are some good vestibular schwannoma therapy YouTube videos which I recommend that are very helpful. And I'll put the links in the description. So at this point, I'm beginning phase 2 of the physical therapy now, and it's going to be quite a while. It's going to be a year or so before the muscles are fully retrained. It's not going to be an overnight thing, but we are charting progress. We can actually see from month to month visits improvement, and so I'm confident that I'm on the right path as long as I continue to do the exercises every day. So that's a good thing. Another update, I haven't really dealt with the hearing issue, because the hearing issue has been kind of a non-factor. I've managed to live with the hearing only really in one ear for a year now, and I've kind of like anybody with a disability, you kind of get used to it. You work around it. It's not affecting my ability to work. It's not affecting my ability really to do anything at this stage. So at some point, I'll probably revisit it. But for now, the physical therapy is my priority rather than the hearing. One interesting thing that did happen, I took my son to a Rolling Stones concert, and there was no problem hearing the music, but I did have a problem hearing the crowd, and not one you would think of. It's not that I couldn't hear the crowd, it's just that that overwhelming flood of sound overwhelmed the nerves. And it didn't sound like a clean, distinct crowd. It sounded almost like white noise. Like it was, I lost the detail in in the sound of that scope. I could hear the music fine, I could hear individuals fine, but I couldn't hear the whole crowd with any definition. It was just mud. And so that'll be something that we address in the upcoming year, kind of seeing if there is anything that can be done about that. And I've heard that there are things that can be done, but I won't speak to that yet unless it's from personal experience. In fact, I've actually used it to my advantage a little bit because I've always gone to like music. I'm a music fan. I like to go to clubs and see bands and things like that. And I went with a friend once, and I used to be one of those guys that you would just be enjoying the show, and there's so much noise, and you can't really hear anything, and your friend's talking to you, and you just kind of nod politely, and then you realize later he said something stupid, and you shouldn't have, agreed to it. But there's a benefit, to my great surprise, by turning my bad ear to the sound, to the stage, to the music. It greatly reduced, obviously, the decibel levels coming from the stage, and making it a little bit easier on the good side to actually hear my friend talking. I could hear both. I could hear the music fine between what little hearing there was on this side and the bleed over to the other side. But I could clearly hear my friend talking even with loud music going. I could live with that. That's a win from my standpoint, because I've never had that luxury before. You're just kind of doing a lot of the trying to lip read. So there are ways that you can use this disadvantage to your advantage. I was very surprised that that was the case. It's kind of funny, but I put that in the plus column. In one of the earlier videos, someone contacted me, and asked me straight up, hand to God, if you had to do it again, would you? And the answer is an unqualified yes, I would. Now, in my case, I now know what the unknowns are on my side. And to be very clear, I don't believe that doctors are going to, especially surgeons, are going to get into all of the things that could potentially go wrong, because they don't want to scare you. It's not coming from a bad place. The brain surgery is scary enough. So they're not going to get into all the things that. But I need you to understand that when you're talking about nerves are going to do what nerves are going to do. As I mentioned in an earlier video, when you break your arm, it's either broke or it's not. But with the nerves, they're going to shift and do weird things, and sometimes it's unexpected. So it is something that you're going to have to prepare. If you're going to have this surgery, maybe you'll be one of the lucky ones where 6 months and you're done. Or you could be one of the unlucky ones where 5 years and you're still struggling. But the downside to leaving the tumor in place, from every person that I've talked to that's had one and let it go too long, including myself, from every doctor that's had to deal with this, not just surgeons specializing in this type of surgery, but from general MDs, if you leave it in place and you don't monitor it, watch it. If you don't monitor it, what's going to happen is it's going to continue to grow in most cases, and it's going to continue to mess with different nerves, and it could be life altering or life threatening because it could potentially affect the brain stem. Now remember, inside the cranium, there's not a it's valuable real estate. There's not a lot of room. So if this thing grows, it's putting pressure on other points in the brain, and you don't know what that's going to look like. You don't necessarily have any control over how the damage is being done to your brain and to the nerves in your brain. So I strongly recommend that if you get this diagnosis, to either watch it super close, or when the recommendation comes to address it, to address it. It is scary as hell, really is, but not addressing it will be a worse decision, I believe, in the long run. Obviously, the doctor makes the final determination on what the recommended path forward should be, not me, some guy on YouTube. But in my case, I waited too long, and I wish I hadn't. I'm suffering now in part because I didn't address it earlier, because the growth much more directly affected the facial nerves. If I had gotten it when it was first diagnosed, I probably wouldn't be having the synkinesis problems, and I would be one of those lucky people that 6 months and I'm back to normal. That did not happen. So I'll see you guys again in about 6 months, and give you an update on what happens with the synkinesis physical therapy. Like I said, I'm very optimistic about it, but it's going to be a slog. It's going to be a hard road. It's not a death sentence. It's not really even any scarier than any other type of surgery, but it is a little more complicated, and the more you know, the better off you'll be.